Hey guys, and welcome back to my channel. So in today's video, we'll be covering on how nursing interviews are actually marked, what they're looking for during the interview, and then we're also going to be covering on the psychometric test that you might be expected to do. Please remember, I am not affiliated with any university or any nursing school, so I cannot give you specifics of what this university is looking for. I'm just giving you a general overview of what the interview panels are going to be looking for, and you just have to work around that. So nursing school interviews are marked on a structured rubric which gives certain weightings or different scoring to different competences, and there's about I think 7 or 8 competences that the interview panel will be looking for. So obviously if one competency has a higher rating, they'll ask you more questions leaning towards that. So the first competency that they'll be looking for is knowledge and understanding of nursing. So this is when they're assessing your awareness of the nursing program, of the nursing profession. So this is when they ask you questions such as, why do you want to become a nurse? What motivated you to become a nurse? They want to know if you actually understand what you're getting yourself into, and if you know what nursing is, or you're just getting into nursing because everyone is getting into nursing. The next competency is obviously communication skills. They want you to have clear, professional, and confident responses. So they're looking at the way you structure your sentences. Do you use ums a lot? Do you use slang? Do you use vague responses? Your body posture, the way you use your hand. They will take your background into effect. If you're someone who doesn't speak English as their first language, they'll mark you based on that. But it's just for them to be able to know, are you able to convey your answers appropriately so that the next person is able to understand what you are saying. Why it's important that you're practicing so that you're better able to convey yourself better. The next competency is critical thinking and problem solving. This is when they're assessing how you handle tough situations, ethical dilemmas. So this is when they ask you questions about, tell us a time that you worked in a team, tell us about a time when you're in a conflict and how you resolved that. They want to know how you think of situations and how you're able to make decisions based on that. They want you to be able to make good decisions. The next competency is empathy and compassion. Obviously, nursing is about showing care, love, compassion, kindness, empathy to the patients that you're going to be working with, their family members, etc. So they're going to be asking you, tell us a situation when you had to show empathy to someone. Then they're also going to be marking you on professionalism and attitude. So this is how you represent yourself, including body language, attire. They also want to know if you're enthusiastic about this, so smiling, giving good responses, being energetic in the interview so that they don't constantly have to coax or try to pull things out of you. Other part of the competencies is knowledge of the program. So this shows whether you researched the school and why you chose it. So they ask you questions of, why did you choose this nursing program? Why this specific school? It almost goes hand in hand with you being aware of why you want to get into nursing. They also want to know, why this specific university? Why didn't you go to the university down the road? And the last competency that they'll mark you on is questions asked at the end. That's why I made a video about this on questions that you can ask, guys. I'm not just saying this so that you can look polite, so that you can look smart at the end of your interview. They actually are marking you on this. And the reason for this is they want to know if you actually have an interest in the university and in the program that you're going into. So when they ask you at the end, do you have any questions for us? Don't say, no, I don't have any questions. You've asked everything. From your research, you're not going to find out everything about this nursing program or this nursing university. As a result, this is a chance for you to get clarification. Even if you're not interested in this university, still ask questions. So all these different competencies can have different scoring systems. So they can either use a numerical system, whether they're rating it on 1 out of 5 or 1 out of 10, or they can give it a descriptive rating: excellent, good, needs improvement type of situation. So there's different types of interview formats and format. Okay, that sounds wrong. But anyway, so there's different interview types, let me rather use that, and how they are marked. So you can have a panel interview where it's different people that are marking you at the same time. And the great thing about this type of interview is that because you're having different people, each person understands you in a different way. And as a result, one person might give you a higher rating in something while someone else is giving you a lower rating. And as a result, they will take an average. Then the next type is you can have multiple mini interviews, which is short scenario-based questions, and each are marked on a separate rubric, and then they put the marks together. And the last type of interview setup they can have is one-on-one interviews, where it's one person, they are marking you on everything. So if you and that person don't gel well, so now we're going to go into the psychometric test, and I'm going to be giving you some examples of what you might get into, but I don't have like this is the question paper for you to practice. The psychometric tests are mostly about you answering these questions based on your instincts and what you know. They're going to be asking you very basic maths, English, and life science questions. So if you've done maths, you've done life sciences, and you've done English in metric, you will be fine. So psychometric tests are used by some nursing schools as part of the selection process to assess candidates' cognitive abilities, personality traits, and situational judgment skills. They help schools to evaluate whether an applicant has the right mindset, problem-solving skills, and emotional resilience for nursing. So as a result, these questions will be based to be able to test those things. Are you able to problem solve? So as a result, if you prepare problem solving, you're not really solving the problem, you've prepared the solution. So that's why I say just go into it with an open mind of what you're going to get when you get there. So first we have the situational judgment test. This is where they measure your ethical decision making, prioritization, and professional behavior. So in these situations, they will give you a scenario, and then they ask you, in this scenario, from option A, B, C, and D, what would you do? You notice a fellow nursing student being rude to a patient. What do you do? A, do you ignore it since it's none of your business? B, do you speak to the student privately and express your concerns? C, do you report them to the instructor immediately? And D, do you apologize to the patient on their behalf and move on? And based on your response of that situation, they will now mark you on, okay, in this situation, was this the good response from you? And as a future nursing professional, is this what is expected of you? So it's them now seeing, okay, on paper, this is how you'd sort of react in this situation. The second type of psychometric test is personality traits, which is where they assess traits like empathy, resilience, teamwork, stress tolerance to see if you fit in the nursing profession. For example, they'll give you things such as I remain calm in high pressure situations. And then they'll give you those type of rating of I agree, strongly disagreeing, neutral, disagree, strongly disagree, and then they'll mark you based on where you fit in that scenario. Be as honest as you can so that they can get a good indication of who you are. I know we all want to be very calm in situations, but if you know yourself that you have difficulty remaining calm in these situations, be honest about it so that it doesn't show up later on. And also that's why they pair up the psychometric tests with the interview panel, where you get to motivate the reason why you react in certain situations in this way. And then the fourth test that they can do is numerical and verbal reasoning. So this is where they're evaluating your logical thinking, reading comprehension, and ability to interpret medical data. So they'll give you basic questions like you have a tablet that is 500 milligrams. However, the doctor wants the patient to get 250 milligrams of this dosage. How many tablets are you giving this patient? Okay, you're giving the patient half. So it's just basic math stuff, but made in a medical situation, and they want to know if you're able to use math. So you need to practice things such as ratios, percentages, fractions, which is what you're doing in your metric math anyway. So you don't really have to practice a lot. And also reading comprehension. If you're able to read a scenario, are you able to understand what is being asked of you? Then the last psychometric test that they can ask you is your critical thinking and problem solving test. So they'll give you scenarios. Scenarios honestly is the number one thing that they were using these. So for example, a patient is showing signs of an allergic reaction to a medication. what's the most appropriate decision. So then they can either do it in an ABCD situation, or they can give you an option to write down what would be your next step. So how a psychometric test fits into your nursing interviews? So like I said, they can either do it before the interview that you have in person or after, so that they have both to see who you are on paper and also who you are in person. They can combine it where they have short scenarios where you're having this small test, this small test, this small test. So all 4 different types, you can have all 4, and they can do mini ones so that they're marking you on every single different type. So how do you prepare for these psychometric tests? I'll put a link down below. There is a site that I found where they have, I think it's about 10 questions that you can practice, which is just basic practice of sort of these mathematical questions that might be asked, allowing yourself to be able to think instinctively. If this was to happen, what would I do? And put yourself in the mindset of a future nurse of, if I was a nurse and this happened to my patient, what would I do? So that is all from me. I think this is the last video in the series of these nursing interviews. The other videos that I've done is the 30 questions that you can practice about nursing interviews. I've also done a video on the questions to ask the interview panel. I've also done a video of what to do if you don't know how to answer an interview question. And also I've done a video of the things to never say or do in a nursing interview panel. And I'll put all the videos here in a playlist for you to go through as you're preparing for your nursing interview. These are all the different aspects of the things that you need to prepare.